Hello and welcome to my channel. In this lecture we'll talk about swallowing. So let's start. Swallowing, the process that initiates after the mastication process is completed and formation of bolus of food. Now it's time to push it downwards in the pharynx and the esophagus. It's called also deglutition. It's closely integrated actions that propel the contents of the oral cavity through the pharynx and esophagus. These actions, some of them are voluntary and the others are reflex actions. A single swallow usually takes 1.5 to 2 seconds from mouth to stomach, and it's divided into three phases. The oral phase is subdivided into the preparatory phase and the oral phase proper, the esophageal phase and the pharyngeal phase, and the esophageal phase. So it's the oral phase, which is subdivided into two. Preparation and the oral phase proper, the pharyngeal phase and the esophageal phase. Now the oral phase is voluntary, while the pharyngeal and the esophageal phases are reflexes. They are involuntary reflexes. Here to show you the different phases of deglutition or swallowing. This is the oral phase. This is the pharyngeal phase. This is the esophageal phase. So the food passes in this direction behind the trachea and the epiglottis to descend into the pharynx and the esophagus. You can see the process of swallowing in this video. See, this is how we swallow things. We swallow the bolus of food. Observe. Okay. The oral phase subdivided, as we said before, into preparatory phase. It involves chewing of food to the right consistency before it gets swallowed, and mixing it with saliva and collecting it into a single mass called the bolus on the dorsum of the tongue. This phase requires muscles of mastication, suprahyoids and infrahyoids, together with the tongue muscles and the muscles of the lips and cheeks to push food back between the teeth. You know, the cheeks, they push the food from the vestibule of the mouth that surrounds the teeth back into the area between the teeth to be properly chewed. Now, the consistency of the chewed food is measured by sensory receptors in the oral mucosa. The oral phase is initiated when food is is now ready to be swallowed, when food is judged to be of right consistency, and the bolus is pushed rapidly backwards towards the oropharynx by raising the tongue against the hard palate from front to back. So the front of the tongue must be pushed against the palate, and the back of the tongue, as we will see now, it will depress actually to allow for the bolus of food to pass through the chute or the pharynx. This action is brought by the elevating the hyoid bone, by the contraction of the suprahyoid muscles, and the musculature of the tongue itself. Now, towards the end of the oral phase, the tongue is in front of the food, is elevated by contraction of the palatoglossus muscle we studied before. Please refer to the pharynx and larynx lectures in the head and neck. Also by the intrinsic muscles of the tongue, and while the back of the tongue is depressed or lowered by the hyoglossus muscles to form, the chute through which the food passes to the oropharynx. The oral phase is completed by using the styloglossus muscles to thrust the tongue back and tip the food down the oropharynx, and the elevated part of the tongue stays in this position during the first part of the second stage, which is the pharyngeal stage. So it seals off the oropharyngeal isthmus to prevent the re-entry of food into the mouth. The lips are closed and the teeth brought into occlusion. That's why it's extremely difficult to swallow while the mouth is open to any degree. And if the mouth is open and we trigger the spots that elicit the reflex pharyngeal and esophageal phases, instead of swallowing, we will get the gag reflex. Gag reflex is stimulated, which has the opposite effect of swallowing. So remember, it's extremely difficult to swallow while the mouth is open, and when we trigger the receptors responsible for starting the reflexes in the pharynx and esophagus, while the mouth is open, we will get the gag reflex instead of the swallowing reflex. Now the pharyngeal phase started. Food moves from the mouth into the oropharynx, and a series of reflexes are triggered by the receptors in the mucosa of the oropharynx that these reflexes execute the second and the third phases of swallowing, or the pharyngeal and the esophageal phases of swallowing. The reflexes are designed to propel the food through the pharynx and esophagus while preventing the food from going back where it shouldn't, like the mouth, like the nasopharynx and nose, and of course the larynx and the lower respiratory tract. The reflexes are elicited when the bolus contacts the sensitive trigger areas. These vary from person to person, but the most common areas are the mucosa covering the palatoglossal arches or the posterior wall of the oropharynx. You remember the palatoglossal, we have two arches, palatoglossal and palatopharyngeal arches. The palatoglossal is anterior to the palatopharyngeal arches, and between them lies the palatine tonsil, if you remember. Now, contraction of the tensor and levator veli palatini muscles tense and elevate the soft palate and pull it upwards against the ridge in the back of the nasopharynx called, or between the nasopharynx and oropharynx called the passavant's ridge, to seal the nasopharynx so the food doesn't go into the nasopharynx. Also, during swallowing, the respiration is suspended briefly to minimize the risk of inhaling food into the larynx. The stylopharyngeus and palatopharyngeus muscles pull the larynx upwards behind the hyoid and under the epiglottis. When they pull the larynx upwards, the epiglottis automatically closes. If you remember the framework of the larynx, you will know how it works. Now, the aryepiglottic folds are tensed by the aryepiglotticus and the oblique arytenoid muscles to narrow the laryngeal isthmus or the laryngeal entrance. The vocal folds are also strongly adducted to seal the larynx and trachea, and they are adducted by the action of the transverse interarytenoid, the lateral cricoarytenoid muscles, and the thyroarytenoid muscles. Imagine all these muscles contract in harmony to produce the complex action of swallowing, passage of food from the oral cavity to the esophagus. Now the pharyngeal constrictor muscles start to contract from above downwards, propelling the bolus of food downwards over the closed inlet of the larynx. Now the food has entered the esophagus. It's moved onwards by the peristalsis of the esophagus. This is called the esophageal phase, which is the third phase of swallowing. Remember the phases of swallowing: the oral phase, pharyngeal phase, and the esophageal phase. This is the third phase, the esophageal phase, which involves the esophageal peristalsis. Now, the epiglottis superior surface is convex, or the oral side of the epiglottis is convex. Why? To be able to or divert the food to the sides, into the pyriform recess at the sides of the laryngeal inlet. The epiglottis keeps the inlet covered as a tree opens. The sensory neurons forming the afferent limb of reflexes involved in the pharyngeal and the esophageal phases are conveyed by the glossopharyngeal nerve. The efferent limb are the motor nerves supplying the many muscles that involved in the reflexes, which include the masticatory muscles, the suprahyoids, the infrahyoids, the facial expression, the tongue, the soft palate, the pharyngeal constrictors, the pharyngeal elevators, and the larynx and respiration. So many nerves involved as the efferent limb of the swallowing reflexes. Now, all these reflexes or all these actions must be coordinated or controlled. There is a central control for coordination to ensure all these muscular activity occurs in correct sequence, and they lie as networks of neurons in the brainstem, which actually receives from the swallowing center in the insular cortex. Now, the function of the insula is vague. Little known about the functions of the insula at the floor of the lateral sulcus of the brain, but it's suggested that it has a role in swallowing. The brainstem centers integrate the activity of the cranial nerves involved in the control of the muscle groups we've mentioned before, and also believed to control the regular unconscious swallows to clear the oral cavity of saliva. While during swallowing of foods or drinks, it's mediated by the swallowing center in the insular cortex, which feeds into the brainstem center. Now, problems in swallowing called dysphagia. Any disturbance to swallowing is called dysphagia. Dysphagia may result from mechanical obstruction. Mechanical obstruction occurs by tumors or by enlargement of the nearby organs like the thyroid, for example. And do not forget that the esophagus lies in the thorax behind the heart, especially behind the right atrium. So also enlargement of the heart or myocardial hypertrophy results in dysphagia. So it's essential in cases of dysphagia to take pictures of the lateral view of the thorax in x-rays, of course. Diseases of the nervous system which affect neuromuscular coordination, like multiple sclerosis, the Parkinson's disease, motor neuron disease, or stroke, may be accompanied by also accompanied by dysphagia. In these cases, swallowing is often slow, and the phases of swallowing become uncoupled instead of occurring as a smooth continuum. So there is difficulty in swallowing. Now, the patient may have difficulty transiting the food from the mouth to the pharynx, or food may pull in the pharynx instead of entering the esophagus. If the vagal sensory innervation of the larynx is compromised in any of the diseases mentioned, the patient may be unable to detect the presence of food in the larynx, and this is a dangerous situation because there is no cough reflex is elicited, and so the patient is subjected to inhalation of food into the lungs, and this will predisposes to infections of lung abscess, respiratory problems. This is called silent aspiration, and is potentially dangerous as mentioned. The person may choke and asphyxiate, or the food may enter the bronchial tree, stagnate and decay, and trigger pneumonia or the lung abscess as mentioned. Now, in cases of lung abscess, if you study the anatomy of the thorax, you will find that the right bronchus is wider. That's why food tends to go to the right lung. That's why cases of lung abscess are more common in the right lung than in the left. I hope you got the maximum benefit from this lecture, and thank you very much for watching.